So let's talk about long-term changes after fat grafting. So a lot of people ask me, what should I expect after fat grafting? Do I maybe need multiple surgeries, or am I good with just one procedure? So generally speaking, fat grafting is considered a permanent procedure, but there are some patients who feel like they don't get a lot of retention after fat grafting. Remember, during fat grafting, liposuction is taken from areas where you don't want fat. The fat is then cleaned, it's processed, antibiotics are added, and then the fat is placed into areas where you want to increase volume. So maybe areas of the face, areas of the breast, or even your buttocks. Once the fat is placed into your body, there is a healing phase where not all the fat survives. Remember, fat needs oxygen and blood to survive. So during the time that the blood vessels are growing into the fat, you will have some volume loss. On average, I would say you should expect about 50% retention, or half the fat to survive. That fat is going to be permanent. In the future, if you continue to gain weight, you can actually expect that fat to grow as well. However, if you begin to diet and you begin to lose a lot of weight, that fat will shrink and you may feel like you've lost your results. Don't worry, the fat cells are still there, so if you were to regain your weight, you are going to regain the volume. But ultimately, fat grafting is a permanent procedure. You're not necessarily going to need another procedure in the future, but you do want to make sure that you maintain your weight, or if you want to look even larger and fuller, then you want to gain weight as well.